My name is Brian Taylor. I am the Director of Project and Portfolio Management at Tampa General Hospital. Tampa General itself is a large academic health system. We've got 6 hospitals, multiple freestanding clinics, over 2,000 patient beds, and we employ roughly 15,000 people. Within IT, IT supports all of that, including all the hospitals and such. We have 3 program managers, and then we have roughly 12 project managers. We are a tremendous growth mode, amazing growth mode that creates its own challenges to try to keep up. The biggest challenge when I came here, I've been here for 3 years, it was the biggest challenge there. We've gotten our arms wrapped a little bit around it, but still problem is that IT is used by just about everybody within the organization and their projects. You know, with ambulatory has a new thing open and they have a real big push to get this done, and so they need IT. And surgical services has a big project and it's their number one priority. They need IT. And then cancer care has 3 projects that are huge and so important and generate $50 million, and they need IT. And so we're kind of the spoke in the middle of the wheel to where everything kind of comes into us. So proper portfolio management, making sure we meet the strategic needs of the hospital and things of that nature is vitally important. When I came, there wasn't a great process for intake and prioritization. We've got all of our intake, not only for IT that now use Workzone, but we've got intake for everything across the enterprise is using Workzone to kind of get everything brought in through one system. So that's the biggest thing, is the discovery, the prioritization, and then, just making sure. What I've told them multiple times is we don't care to stay busy. We just want to stay busy on the right work. And Workzone helps us do it. I really wanted the absolute simplest application that I could get that still gave us what we needed. We had a team that kind of went through it, and everybody kind of agreed that this would do the trick. So we started in October of 2022. We started with 50 licenses, which was enough for my PMs and all of our directors. I think we have 600 licenses now, and it's everybody in IT. It's VPs within the organization. I get not a week goes by that I don't get another department that's wanting to come on to Workzone. So I had one yesterday. We're constantly expanding. We're doing things right now with Workzone that I had no idea, especially at 3 months, that we would be doing. I'll give you a reference there. One of our first groups that came on here was our performance improvement group. And they were the first ones that kind of came to me and said, hey, we need some help. Somebody said something about Workzone, and it kind of sounds like that might help us. So, I did a demo for their leadership. We made some users in a test system, and then they're like, this is great, we need this. And I think the last time I checked, they've got over 250 projects in the system. So without Workzone, they're doing that on Excel. They're much less efficient than they are now. And it works really well. And I get those that are coming in, like I said, probably on a weekly basis. Patient safety, quality, patient experience. I mean, there's just a lot of groups that are using it on a regular basis. At any point that I need support, I can get it through an email, and usually 15 or 20 minutes I hear back. A phone call I can get into immediately, chat I can get to immediately, and it's not that I get somebody to answer this phone and says, hold please, let me find somebody to talk to you, and then they find somebody to talk to you. Oh, that's a different team, let me send you over here. If I talk to Chris, then Chris owns it, and I'll be talking with Chris up until the follow-up of, hey, did this fix, did this work? Yep, it worked. Okay, I'm closed out. Fantastic. So you've got one person you're dealing with to report the issue, to troubleshoot the issue and to follow up on the issue. So it's top-notch support. I would say the support model of Workzone is top tier. I really like the fact that I can edit multiple things at one time, as opposed to, if I need to change start date for 13 projects. Used to, I would click on each of those 13 projects to change the start date. Here I have a multiple move feature. I select those 3 and put what I want the start date to be, and it moves it right across. They used to have Nike projects. And so the slogan for Nike is just do it. So we had projects come in that didn't go through discovery, that didn't get prioritized. They were Nike projects. And so I had a little funeral for Nike projects. And so we don't say those words anymore because, that was at the expense of our work-life balance for our team members, and burnout was high, and we had to overcome that. So we've made really good progress on decreasing the factors and the problems with our team member satisfaction. Workzone can benefit all hospitals. Hospitals are also very liquid in that the priority today may or may not be the priority tomorrow. And so Workzone gives us the ability to respond to that in a fluid manner. It's customizable. It really would help hospitals everywhere. And also, Workzone understands that we never have a finished product. And that's very true as we deal with healthcare. Especially technology in healthcare, where the field changes drastically all the time. They're also soliciting feedback from myself and people like me that are in positions that use it daily and say, hey, how about this? Have you thought about this? So, as good as Workzone is, it's going to be better tomorrow, and it'll be better the month after that. And I would recommend everybody to give it a try.